one of the common disease that actually affect the female reproductive system. Hello everyone, you're welcome to my channel. This is Next Stephanie. All right, in today's video we're going to be talking on one of the common disease that actually affect the female reproductive system. Like we mentioned in our last video, I said we're going to take each of these common disease. We're going to take each of it, explain in details, and give their sign and symptoms so that we can differentiate from what is what. All right, so in today's video we're going to be talking on one of the common diseases that affect the female reproductive system, which is endometriosis. We're going to talk here on endometriosis. We're going to talk on the risk factors, the causes. We're going to talk on the signs and symptoms and the complication. If left untreated, what will happen? All right, so stay tuned. So if you're new in this channel, do well to like, subscribe, and also share my videos to your friends and loved ones. And also please don't forget to ring the notification bell for more of this educative video. And also don't forget to leave a comment. Any question, I am ready to answer all your worries. All right, thank you. Let's continue. All right, endometriosis actually is a disease condition in which, or it is a painful condition in which tissue that are similar to the inner lining of the uterus or tissue that are similar to the endometrium actually go out of the uterus. Actually, it is a painful condition in which tissue that are similar to the inner lining of the uterus actually grows out of the uterus. The main parts in which this tissue grows, we have the ovary, we have the fallopian tube. Actually, it leaves the inner lining of the uterus and actually grows out of the uterus. There is at the ovary. If you check our last video, the anatomy of the female reproductive system, you're going to know what I mean by the ovary. You're going to know what I mean by the fallopian tube. So this tissue that are similar to the inner lining of the uterus actually grows out of the uterus, in which it was supposed to grow in the uterus where it belongs, because it is this inner lining that sheds every month. So when it leaves where it is supposed to grow and grow out of the uterus, it actually causes so many things. All right, so let's continue. So this actually, it is a condition or a painful condition. Like I said, it is a very painful condition in which tissue that are similar to this inner lining of the uterus actually grow out of the uterus. Places like the ovary, the fallopian tube. It actually goes and find its place there and grow out of the uterus. And when every month this inner line of the uterus shed and flow out of the vagina, it shed but it does not flow out. But it remain in the reproductive system. Like I said, this actually behave like the inner lining of the uterus. Since it thicken every month, this actually grows and also thicken. So when it grows in the ovary, in the fallopian tube, or in the lining of the pelvis, it actually thicken and also shed, but it does not flow out of the body because this actually occurs. You always discover that you feel that pain during your menstrual cycle, or during menstruation. For example, if this endometriosis actually affect the ovary, cysts, also known as endometriomas, are going to be formed. Bands of fibrous tissue called adhesion can also be formed, which can cause pelvic tissue and other organs to stick together. All right, let's move down now to the causes of this endometriosis. What are the causes? For one, we have retrograde menstruation. Actually, this is when the menstrual blood actually flows back into the fallopian tube and actually into the pelvic cavity, where it sticks to the pelvic wall. And this blood have endometrial cells, which actually continue to thicken and actually shed, but it does not flow out of the body, but it remains there. So this can actually causes endometriosis. Like the second, we have surgical scar complication. Especially this happens to those who have once been operated upon before, like especially those who have once been operated for cesarean section, that is C-section, for those who get virtual cesarean section, right? The uterus that has once been operated before, the scar there, these endometrial cells can actually stick to the scar, and there it continues to grow, and there each month it continues to thicken and also shed blood, but it does not flow out of the body. So each month, each menstrual cycle, it occurs just like the inner lining of the uterus does. So this can actually causes endometriosis. All right, now we're going to move down to the risk factor. What actually can lead to endometriosis? All right, the first risk factor that we have here is having high level of estrogen, the hormone estrogen in the body. The second, we have low body mass index. The third, we have those who never give birth. The last risk factors that we have here is those with heavy menstrual bleeding that lasts longer than 7 days. All these are actually the risk factor for this. Now we're going to move down to the 6 signs and symptoms of this endometriosis. The 6 signs and symptoms. The first, we have painful menstruation. When I talk of painful menstruation, there is painful menstruation, which is also known as dysmenorrhea. It actually comes, the pain is more than that in which you experience when it comes to painful menstruation. It actually comes to painful menstruation. You have that pain during your menstrual cycle. Even the pain can even start before the day of your menstruation. The second that we have here is pain during or after sex. Actually, some people actually experience pain during sexual intercourse or pain after sexual intercourse. The third that we have is excessive bleeding. There is heavy bleeding, excessive bleeding that can even last longer than 7 days. The fourth that we have here is pain with bowel movement and during urination. That is, you have pain when you're using the toilet, you actually feel that pain. All right, then the fifth that we have here is infertility. All right, and the last one, we have other condition like fatigue, constipation, nausea, vomiting. All these can actually be symptoms of endometriosis. All right, so those are the symptoms of endometriosis. So now we're going to move down now to the last part of this video, which is the complication. If this is left untreated, if endometriosis is actually left untreated, what can happen? Number one, we have infertility, and the last, we have ovarian cancer. So these are actually all what we had for today's video. As for the treatment and the prevention, endometriosis actually cannot be cured and it cannot be prevented. As for the treatment, endometriosis actually some medication can actually help, and in some cases only surgery is the only option. All right, so that is all what we have for today's video. Thank you for watching. See you in my next. Bye.